For some patients, including patients who require distance correction, a technique called Monovision could be a solution to their eyes over 40 vision problem. Doctors Tooma, Franklin Lusby, and Jonathan Pernazar are experts in refractive and implant surgery. They spoke to us about LASIK surgery for patients who need reading glasses.
In my opinion, LASIK is one of the most safe procedures that are ever done. More than 30 million people around the world have had LASIK. I've operated on more than 300 eye doctors, more than 500 physicians, including my brother, who's an orthopedic surgeon. In fact, in a few months, I'll be operating on my son. So I believe that LASIK is as safe as it can be, and Monovision LASIK is just LASIK.
To date, how many cases of LASIK have been done? Well, worldwide, it's probably 28 million, depending on which authority makes the estimate. But it's certainly not a small number. Monovision LASIK is a way of performing LASIK in which we set one eye for distance and the other eye for near. And it's a way, it's a get around for the reading glasses problem, so that people who can do monovision and do it successfully will find that the bulk of the day, say 90% of the day, they won't need any glasses at all.
So I had Monovision LASIK, and immediately after the procedure you can see better.
But the key thing is you can test the outcome very accurately with contacts ahead of time. So how it will be with the contact lens test is virtually identical to how it will be after the LASIK surgery. It's extremely rare now that we operate on somebody to do Monovision LASIK and have it not work the way we expect it to.
I was so afraid of LASIK. I didn't get it until I was 51 years old.
If you're considering LASIK surgery, there are probably two key areas that you should really zero in on. One is technology. There's no substitution for state-of-the-art lasers used in the treatment. The second is the experience of the surgeon. There's no substitute for that either. The combination of the two is really critical. To find an experienced surgeon, somebody who has good outcomes, good results, that's where a referral is invaluable. Whether it's somebody who's previously had surgery with that surgeon or that facility, or if your family optometrist may happen to have a relationship with somebody or a center that they have good experience with. Those things I find put patients very much at ease when they're considering the surgery.
So I am able to see at distance out of one eye, but I can also see near vision. And with both eyes open, I have 20/15 vision, which is better than 20/20, but I can still read up close. So being able to have options was very important to me, and I've been thrilled with Monovision. And I didn't need glasses for the first time as I was driving. And that's when it hits you that this is something that's going to change your life forever.
Immediately you notice the difference because you don't need glasses to read, you don't need glasses for distance. It's a strange sensation actually, because it's funny, because I would normally watch TV before I went to bed, and even to this day, and it's been a couple of months since I've had it, I reach for my glasses to put them on before I watch television, and I have to stop myself even still. But it's totally liberating.
You're never too old to have LASIK. When you have the right surgeon, you can have the procedure and you can have the right results.
Another way to treat patients with cataract surgery to try and get them glasses free is to place a monofocal lens in one eye, get that, let's say that right eye perfectly set for distance. You put another lens in to set it more for up close. Essentially what we're doing is monovision like you would do with LASIK, we can do it with cataract surgery. The blended lens or blended monovision when you're doing cataract surgery, let's say with the Star Nanoflex, is a really good option, and it can work for a lot of patients, especially in a patient who has already been doing monovision with contacts, let's say before cataract surgery. If they were doing monovision with contacts before cataract surgery, then I absolutely would recommend doing a monovision or a blended vision with the lens implant.